Welcome, everyone. I'm excited to be here today to guide you through a comprehensive overview of arterial blood gas interpretation. Today's presentation is titled Comprehensive Guide to Arterial Blood Gas, ABG Interpretation, with a focus on understanding oxygenation, acid-base balance, and their clinical implications. Over the next few slides, we'll explore how to analyze ABGs effectively, what they tell us about a patient's respiratory and metabolic status, and how to apply this knowledge in practice. Let's get started. Today, we're going to focus on arterial blood gas interpretation, which is a crucial skill in assessing a patient's respiratory and metabolic status. This slide serves as a comprehensive guide to help you understand the key concepts involved in interpreting ABGs. As we go through, I want you to pay close attention to how each component provides insight into the patient's acid-base balance, oxygenation, and ventilation. Remember, the goal is to develop a systematic approach so you can quickly and accurately analyze these blood gases in clinical practice. So, let's dive into the essentials that will help you master ABG interpretation effectively. Let's start by understanding the basics, because knowing the normals is essential before we interpret any arterial blood gases. On this slide, we're focusing on 4 key parameters: HCO3, PaO2, PaCO2, and pH. First, let's talk about HCO3, or bicarbonate. The normal range is between 22 and 26 mx/L. This parameter tells us about the metabolic component of acid-base balance. An abnormal HCO3 can indicate metabolic acidosis or alkalosis, so it's crucial to evaluate in context. Next, we have PaO2, which measures the partial pressure of oxygen in arterial blood. The normal value is 80 to 100 mmHg. This gives us an idea of how well oxygen is being transferred from the lungs to the blood, and it's vital for assessing oxygenation status. Then there's PaCO2, representing the partial pressure of carbon dioxide. Normal levels are between 35 and 45 mmHg. This parameter reflects respiratory function and helps us understand if the lungs are appropriately eliminating CO2, which is crucial for maintaining acid-base balance. Finally, pH indicates the acidity or alkalinity of the blood, with a normal range of 7.35 to 7.45. Understanding pH is fundamental because it summarizes the overall acid-base status, influenced by the levels of HCO3 and PaCO2. By thoroughly knowing these normal values, we set the foundation for accurate interpretation of ABGs, which is the core of managing our patients effectively. Let's now move on to slide 4, where we focus on the key points for interpreting arterial blood gases. Understanding these points is essential because they form the foundation of accurate assessment. First, we need to look at the pH to determine if the blood is acidosis or alkalosis. Then, we examine the partial pressures of oxygen and carbon dioxide to understand gas exchange efficiency. It's also important to assess the bicarbonate levels, which tell us about the metabolic component. Remember, the goal is to analyze both the respiratory and metabolic components to get a clear picture of the patient's acid-base status. Connecting these points to the overall theme, mastering ABG interpretation helps us make precise clinical decisions and improve patient outcomes. So, keep these key elements in mind as we proceed through the next steps. Now, let's look at how we classify oxygenation status using arterial blood gas analysis. This slide provides a comprehensive guide to interpreting ABG results, specifically focusing on the partial pressure of oxygen, or PaO2. When assessing a patient's oxygenation, the first step is to classify the severity of hypoxemia based on the PaO2 value. Starting with severe hypoxemia, this is when the PaO2 drops below 40 mmHg. At this level, oxygen levels are critically low, and it indicates a significant impairment in oxygen transfer. Next, we have moderate hypoxemia, which is characterized by a PaO2 between 40 and 59 mmHg. This suggests that the oxygenation is compromised, but not as critically as in severe cases. Then there's mild hypoxemia, with PaO2 values ranging from 60 to 79 mmHg. Here, oxygen levels are somewhat reduced but may still be manageable with appropriate interventions. Finally, a PaO2 between 80 and 100 mmHg indicates normal oxygenation. At this level, oxygen transfer from the lungs to the blood is generally sufficient to meet the body's needs. Remember, classifying the oxygenation status helps us determine the severity of hypoxemia, guiding us in making appropriate treatment decisions. It's a key component of ABG interpretation and an essential step in managing respiratory conditions effectively. Let's take a closer look at oxygen levels in arterial blood gases. When we see a value close to the normal range, such as a PaO2 of 83 mmHg, it indicates near normal oxygen saturation. This suggests that the patient's lungs are effectively oxygenating the blood. Moving on, a PaO2 of 74 mmHg reflects a moderate oxygen level. It's still within an acceptable range, but shows some decrease in oxygen saturation. This might mean there's some impairment in gas exchange, but it's not yet critical. When we encounter a PaO2 of 52 mmHg, we're dealing with a severely reduced oxygen level. This is a sign that oxygen saturation is significantly compromised, and the patient may be experiencing hypoxemia. Finally, a PaO2 of 34 mmHg indicates a critical low oxygen level. This is an emergency situation, showing a severe drop in oxygen saturation that requires immediate intervention. Understanding these ranges helps us assess how well the lungs are functioning and guides our clinical decisions. Remember, these values are vital indicators of the patient's oxygenation status and overall respiratory health. Now, let's move on to understanding the classification of acid-base disturbances. On this slide, we're focusing on the pH ranges that help us determine if a patient is in a normal, acidosis, or alkalosis state. A pH between 7.35 and 7.45 is considered normal. When the pH is greater than 7.45, we classify it as alkalosis, indicating the blood is more alkaline than normal. Conversely, if the drops below 7.35, that indicates acidosis, meaning the blood is more acidic. It's important to classify the pH correctly because it guides our interpretation of the underlying disturbance. So the key question here is, does the pH value represent acidemia or alkalemia, or is it still within the normal range? Recognizing this helps us determine if the patient is in a state of acid-base imbalance or not. Remember, understanding where the pH falls in these ranges is fundamental to our overall interpretation of arterial blood gases. It provides the first clue in diagnosing and managing acid-base disorders effectively. Let's take a closer look at some examples of pH levels to understand what they tell us about the blood's acidity or alkalinity. First, we see a highly acidic pH level, which in this case is 7.2. This value indicates a more pronounced acidic environment in the blood. Such a low pH can be a sign of underlying issues like metabolic acidosis or respiratory failure, so it's important to recognize this as a significant deviation from normal. Next, we have a neutral pH level, which is around 7.43. This is very close to the ideal neutral point of 7, indicating a balanced state where the blood's acidity and alkalinity are well regulated. Maintaining this balance is crucial for proper cellular function. Then there's a slightly alkaline pH, measured at 7.54. This suggests the blood is a bit more alkaline than normal, which could point to conditions like alkalosis. Again, understanding these subtle shifts helps us assess the overall acid-base status of our patient. Finally, we see a slightly acidic environment with a pH of 7.32. While still close to normal, it indicates a mild acidosis. Recognizing these variations allows us to determine whether the body's compensatory mechanisms are working or if intervention is needed. Overall, these examples highlight how the pH level provides vital clues about the body's acid-base balance, reinforcing why careful interpretation of ABGs is so essential in clinical practice. Let's take a closer look at the PaCO2 levels and what they tell us about acid-base status. Normal PaCO2 ranges from 35 to 45 mmHg. When the level is above 45 mmHg, it indicates acidosis, meaning there's too much carbon dioxide in the blood. Conversely, if it's below 35 mmHg, that suggests alkalosis, which means there's too little carbon dioxide. Now, it's important to ask ourselves, is this PaCO2 level consistent with the pH? If it is, then we're likely dealing with a primary respiratory acid-base problem. To determine this, we classify the PaCO2. Since it's the respiratory component, we need to see if it's normal, elevated, or decreased. This helps us understand whether it could be causing acidemia or alkalemia by itself. By understanding these levels, we can start to piece together the bigger picture of the acid-base disturbance. Remember, this classification is fundamental when interpreting ABGs because it guides us to recognize whether the problem originates from the respiratory system or elsewhere. Let's take a closer look at the PaCO2 levels and what they tell us. When we see a slightly elevated PaCO2 level, around 47 mmHg, it indicates an acidotic increase in carbon dioxide levels. This suggests that the body might be retaining CO2, leading to a more acidic state. On the other hand, a low PaCO2 level, such as 24 mmHg, points toward an alkalosis in the blood. This means there's less CO2 circulating, which could be a result of hyperventilation or other factors causing the blood to become more alkaline. A normal PaCO2 level, around 37 mmHg, reflects what we'd consider typical or healthy carbon dioxide levels in the blood. It's a good baseline indicator that the respiratory component is functioning normally. Finally, when we see an elevated PaCO2 level like 52 mmHg, this again suggests an acidotic situation, indicating that the blood is holding onto too much CO2. Recognizing these variations helps us interpret the patient's acid-base status and guides our management. Remember, these levels are key in understanding the respiratory component of acid-base balance, tying into the overall picture we're building in this guide. Let's take a closer look at the classification of acid-base disturbances. On this slide, we're focusing on the key ranges for bicarbonate, or HCO3, levels in the blood. Normal HCO3 levels typically fall between 22 and 26 milliequivalents per liter. If the HCO3 is greater than 26, it suggests alkalosis, meaning the blood is too basic. Conversely, if it's less than 22, that indicates acidosis, which means the blood is too acidic. Now, an important question to ask when analyzing ABG results is, does the HCO3 level match what we're seeing with the pH? If yes, then we're likely dealing with a primary metabolic acid-base problem. That means the metabolic component is primarily responsible for the disturbance, rather than respiratory factors. When we're determining whether there's a primary metabolic acid-base issue, the next step is to classify the HCO3. This helps us understand the metabolic component's role, whether it's normal, or if it's elevated or decreased enough to cause acidemia or alkalemia on its own. In summary, understanding these HCO3 levels and their relationship with pH is crucial. It guides us in identifying whether the disturbance is metabolic and helps us plan our next diagnostic steps accordingly. Let's look at some examples to clarify how we interpret bicarbonate levels in arterial blood gases. First, when we see a bicarbonate level that falls within the normal range, like 25 mx/L, we recognize that the body's acid-base balance is currently stable. This is our baseline, indicating no immediate disturbance. Next, consider a significantly elevated bicarbonate level, such as 42 mx/L. This suggests an alkalosis, meaning the blood is more alkaline than normal. Elevated bicarbonate often points towards respiratory or metabolic causes of alkalosis, which we need to identify in the clinical context. On the other hand, a low bicarbonate level, like 19 mx/L, indicates acidosis. In this case, the blood is more acidic, and it might be due to metabolic acidosis or compensation for respiratory acidosis. Recognizing these low levels helps us determine the underlying issue quickly. Finally, an elevated bicarbonate level again signals alkalosis, such as 32mx/L in this example. This reinforces the importance of understanding whether the body is compensating or actively experiencing an imbalance. Remember, these values are vital clues in the broader picture of ABG interpretation, helping us pinpoint whether the disturbance is metabolic or respiratory, and whether the body is compensating appropriately. Now let's move on to step 1. Assessing the pH here, we're simply checking if the pH is within the normal range, which is typically between 7.35 and 7.45. If it's outside this range, we know there's an acid-base disturbance that needs further evaluation. Next, in step 2, we analyze the PaCO2 value. This tells us about the respiratory component. An elevated PaCO2 suggests respiratory acidosis, while a low PaCO2 indicates respiratory alkalosis. Then, in step 3, we look at the HCO3 level. The bicarbonate reflects the metabolic component. An increased HCO3 points to metabolic alkalosis, and a decreased HCO3 indicates metabolic acidosis. In step 4, we compare the effects of PaCO2 and HCO3 on the pH. This helps us determine which system, respiratory or metabolic, is primarily responsible for the acid-base imbalance. Finally, in step 5, based on that comparison, we identify the responsible system. If the pH abnormality is due to PaCO2, it signals a respiratory issue. If it's due to HCO3, it's a metabolic problem. Recognizing this connection is key to understanding the underlying cause of the disturbance. Now, let's look at some key indicators on this ABG example of respiratory acidosis. First, the bicarbonate concentration, or HCO3, reflects the bicarbonate levels in the sample. In this case, it's normal at 24. This tells us that the bicarbonate isn't compensating or contributing to the acidosis. It's within the expected range. Next, we see the carbon dioxide pressure, or PaCO2, which indicates how much carbon dioxide is in the blood. Here, it's elevated at 51, and that's what's driving the acidosis. Elevated PaCO2 is a hallmark of respiratory acidosis because it shows the lungs aren't eliminating CO2 effectively. Finally, the pH value is 7.26. Since this is below the normal range, it confirms the blood is more acidic, indicating acidosis. Putting it all together, the high PaCO2 with a normal bicarbonate and low pH points to respiratory acidosis. This is a classic example where the primary problem is with the lungs, leading to CO2 retention and increased acidity in the blood. Understanding these key values helps us diagnose and manage the underlying respiratory issues effectively. Let's take a closer look at this example of a metabolic alkalosis ABG. First, we see the bicarbonate concentration, or HCO3. This value reflects the amount of bicarbonate in the blood sample, and in this case, it's elevated, indicating an alkalosis level. Remember, higher bicarbonate levels often point to a metabolic component contributing to the alkalosis. Next, we have the carbon dioxide pressure, or PaCO2. This measures the partial pressure of carbon dioxide in the blood. Here, it's shown as normal, which suggests that the respiratory system isn't compensating or contributing to the alkalosis at this stage. Then, we look at the pH level, which indicates the overall acidity or alkalinity of the blood. A pH of 7.48 confirms that we're dealing with an alkalosis situation. Putting it all together, the elevated bicarbonate and the increased pH tell us we're dealing with a metabolic alkalosis, especially since the PaCO2 is normal. This example helps us understand how each parameter provides a piece of the puzzle, and analyzing them collectively allows us to accurately interpret the acid-base status.